Lower back discomfort after age 50 frequently originates from lumbosacral joint restriction rather than muscular weakness alone, representing body's adaptation to decades of movement patterns. Today we're covering 4 neuromuscular reset movements specifically targeting lumbosacral joint mobility: prone elbow press for spinal extension, supine knee rotations for rotational mobilization, bird dog with knee hover for deep stabilizer activation, and standing hip circles for pelvic control. These movements address joint stacking from postural habits, rotational movement loss, multifidus muscle deactivation, and gluteus medius weakness. When practiced correctly and consistently, they help restore natural spinal balance, reduce chronic stiffness, improve movement confidence, and support functional independence. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have acute back injury, disc herniation, severe osteoporosis, recent spinal surgery, or chronic pain conditions requiring ongoing treatment. Understanding lumbosacral joint dysfunction after 50. For millions of adults over 50, lower back discomfort has become normalized, yet pain frequently originates not from muscles but from joints that stopped moving correctly years ago. Specifically, lumbosacral joint, the final spinal joint where spine meets pelvis, acts as shock absorber for every step, sitting position, and bending movement. Over time, habits like couch slouching, elevated feet sitting, or bed working jam this joint out of optimal position, locking it into alignment it was never designed to maintain. Stretching hamstrings repeatedly proves ineffective if this joint remains frozen, causing pain's inevitable return. This phenomenon, called joint stacking, occurs when years of uneven pressure compress single spinal chain link. When this link becomes rigid, brain generates protective pain signals like smoke alarm activating even without actual danger. These 4 movements prove essential because they don't simply loosen tissues but retrain spine's movement capacity, reconnect stabilizing muscles, and restore mobility where rigidity has developed. This represents retraining approach rather than temporary relief strategy, addressing root movement dysfunction rather than symptoms alone. Movement 1, prone elbow press for spinal extension reset. Most adults over 50 receive instruction to protect backs by avoiding movement, yet spine represents living structure built for motion. This exercise functions as neuromechanical reset, reversing slouched sitting effects, particularly sagging posture jamming lumbosacral joint into locked painful position. Each slumped sitting session compresses this joint, and over time, body learns maintaining this compromised state. This position gently communicates to nervous system message of returning to neutral alignment. Lie face down on firm surface like yoga mat or carpeted floor. Rest forehead down momentarily and breathe naturally. Slowly press up onto elbows while keeping hips and pelvis firmly on floor, creating gentle backward bend. Avoid pushing excessively high, lifting only enough to feel slight spinal extension. Hold position 30 seconds while breathing calmly. If sensation feels too intense, lower briefly for a few seconds then return. Over time, build toward 1-minute hold, potentially adding gentle movement by bending one leg at a time and slowly rotating it across other. Skip to next exercise if experiencing sharp pain, but mild stiffness or discomfort often signals back needs this movement. What proves fascinating is how quickly some people experience relief, often within 20 to 30 seconds, not from increased flexibility but because joint finally receives permission to decompress. From scientific perspective, this movement loads spine in extension, reactivating spinal stabilizers and reducing nociceptive pain signals from compressed tissues. This returns control to individual rather than requiring external adjustments or stretches, restoring motion in spine's most fundamental joint, one influencing hips, legs, and balance. When performed daily, even just 1 minute, this movement quietly retrains back from chronic stiffness toward freedom. Movement 2, supine knee rotations for gentle mobilization. Some movements don't just work body physically but reassure nervous system of safety. This gentle side-to-side rotation accomplishes exactly that, called gentle unwinding because it addresses body parts locked in protective mode for years. Think of spine like zipper where stuck base, usually at lumbosacral joint, prevents rest of back from moving freely, everything stiffening to protect that single jammed area. This simple rocking movement nudges joint into motion softly and rhythmically, like oiling rusty hinge. Beyond this, it reintroduces rotational movement, something most bodies over 50 have lost from years of limited linear habits including sitting, walking, standing, with rotation representing missing link. Lie on back on bed or firm surface. Bend knees bringing them up so thighs are vertical and calves relaxed. Keep arms gently out to sides for balance. Slowly let both knees fall together to one side only as far as feels comfortable, avoiding forcing them to touch surface. Return to center then guide to opposite side, moving in slow relaxed rhythm side to side like pendulum. Continue approximately 30 seconds or until feeling light release. For some people, movement may only reach halfway down, which proves perfectly acceptable. Goal involves gently mobilizing spine through rotation rather than pushing range of motion. This proves especially effective before bed or first thing morning when stiffness is most noticeable. What proves remarkable is brain's response. Joints contain motion sensors called mechanoreceptors that, when detecting gentle movement, send calming signals to brain, reducing pain perception and muscle tension. This isn't just stretching but neuromuscular communication. Every side-to-side shift tells spine it's not stuck, it's moving again, it's safe. Over time, this resets baseline where previously painful movements become easy, morning stiffness fades, and body learns relaxing instead of bracing. Movement 3, Bird Dog with Knee Hover for deep core activation. Back pain might not originate from visible weakness but from deep muscles that have gone silent. Bird Dog with Knee Hover, despite appearing simple, represents one of most neurologically powerful movements for people over 50, called deep core awakening because it wakes multifidus, small but vital muscle running along spine deep beneath surface. After 50, especially with back pain history, brain begins turning off this muscle group, causing it to stop firing properly, meaning spine loses its internal protective system. When this occurs, stiffness sets in and compensations begin, with body recruiting wrong muscles for stabilization work. Begin on hands and knees with hands directly under shoulders and knees under hips. Gently engage abdominal muscles as if bracing for light stomach tap. Lift right arm straight forward, thumb up, while gently hovering left knee approximately 1 inch off ground. Hold 5 seconds then return to start. Switch sides with left arm out, right knee hovering. Focus on maintaining steady torso without rocking or twisting. Move slowly with control. Repeat several times each side until feeling mild fatigue, 3 times weekly. As strength develops, progress to lifting opposite arm and leg simultaneously, but only when maintaining perfect form and control. When gently hovering that knee, something remarkable occurs as you re-engage stabilizers, not just moving but controlling movement. This exercise taps into reflexive stability concept, the idea that body can automatically protect itself through deep muscle activation. Once proper pathways reawaken, think of it like flipping circuit breaker back on, requiring precision, timing, and awareness rather than massive effort. This movement improves not just pain but balance, fall prevention, and walking stability, all declining after 50 when these deep core muscles go dormant. This rebuilds spine's internal defense system, emphasizing stability from inside out rather than superficial strength appearance. Movement 4, Standing hip circles for pelvic stability. This movement, called pelvic compass, reorients body's internal positioning system for balance, posture, and lower back stability. Gluteus medius and other deep hip stabilizers often get overlooked, yet when weakening, which occurs incredibly commonly after 50, pelvis begins tilting with each step taken. That tiny tilt places constant torque on lumbosacral joint, the same joint addressed in previous exercises, yet most people never train these muscles directly. Stand tall facing wall, feet shoulder width apart. Gently place fingertips on wall for balance without leaning weight onto it. Shift weight onto left leg keeping it slightly bent. Lift right leg slightly off floor and begin drawing slow wide circles with knee or foot, moving forward, out to side, around, and back in. Move as slowly and controlled as possible, like moving through water, avoiding rushing or swinging leg. Continue 30 seconds or until feeling light fatigue in outer hip muscles, then switch legs. As strength develops, try tilting pelvis slightly outward during top of each circle for increased activation. This motion targets muscles critical for keeping pelvis level and spine aligned, especially during walking, stair climbing, or standing from chairs. This movement proves different because it challenges balance, mobility, and coordination simultaneously, activating exact muscles responsible for maintaining level pelvis and neutral spine. From scientific perspective, this represents closed-chain balance exercise retraining proprioceptive system, the internal sense-informing brain of body's spatial position. When this system improves, not only does back pain decrease but fall risk drops dramatically, mattering significantly because after 50, falls become life-altering events rather than simple slips. When performed regularly, this exercise quietly rebuilds pelvic stability, postural control, and spinal alignment without requiring fancy equipment or high-impact movement. It's simple but not easy, representing one of most underrated protectors of long-term independence. Understanding adaptive capacity after 50. Remember, you're not fragile but adaptive. Spine, joints, and muscles have all been adjusting to how you've lived rather than how you've aged, meaning change remains always possible, not through punishment or excessive pushing but through intentional, intelligent movement. Start small with just one exercise once daily, performed with focus, potentially shifting how back feels and functions. Most importantly, don't chase pain relief but chase control, because when moving with purpose, body listens, and when body listens, it heals. These 4 movements may seem simple, yet their impact proves substantial. They speak directly to deepest nervous system layers, reminding brain that body remains capable, responsive, and worthy of care. Don't chase perfection but chase presence. Let consistency, not intensity, be greatest strength. Performing movements safely and effectively. Practice these movements with proper attention to form and body signals. Start with one movement daily, gradually adding others as comfort develops. Focus on quality over quantity, proper positioning over hold duration, and gentle progression over rapid advancement. These movements work best when performed consistently rather than intensively, with daily gentle practice proving more effective than occasional demanding sessions. Safety considerations and precautions. Do not perform these movements without consulting healthcare provider if you have acute back injury or active sciatica, recent spinal surgery or fusion, severe disc herniation with nerve compression, uncontrolled pain requiring ongoing medication, severe osteoporosis with high fracture risk, or acute inflammatory conditions. Even for healthy older adults, start conservatively with gentler ranges and shorter holds, progressing gradually over weeks. Stop immediately if experiencing sharp shooting pain, radiating leg pain or numbness, severe back spasm, dizziness or balance loss, or significant joint instability. Mild stretching sensation and muscle engagement are normal, acute symptoms are not and require medical evaluation. Realistic expectations and timeline. Benefits develop progressively through consistent practice. Weeks 1 to 2, learning proper movement patterns, developing body awareness, establishing routine, initial mobility feelings. Weeks 2 to 4, improved movement quality, beginning pain reduction, enhanced breathing coordination, reduced morning stiffness. Weeks 4 to 8, clearer functional improvements, noticeable flexibility gains, better movement confidence during daily activities, enhanced postural comfort. Weeks 8 to 12 and beyond, maintained progressive improvements, established sustainable practice, clear functional benefits supporting independence, continued spinal mobility enhancement. However, inconsistent practice limits benefits, emphasizing importance of regular gentle movement over occasional intensive sessions. Integration into daily routine. These movements integrate easily into daily routine. Ideal timing includes morning before rising for gentle awakening, mid-morning break for stiffness relief, afternoon for tension release, evening before bed for daily strain relief, or combined into single 10-minute mindful session. Consistency matters more than perfect timing. Choose times working reliably within schedule, enabling sustainable practice, becoming natural habit rather than additional burden. Complementary practices for spinal health. These movements work best combined with regular gentle walking, maintaining cardiovascular health, proper sitting posture with lumbar support, frequent position changes during prolonged sitting, adequate hydration supporting disc health, core awareness during daily activities, and stress management practices reducing muscular tension. Comprehensive approach addresses multiple factors affecting lower back health and functional mobility. Monitoring progress. Track both movement quality and functional improvements. Movement metrics: improved body awareness during exercises, smoother movement transitions, deeper breathing capacity, reduced compensatory patterns, increased comfort holding positions. Functional improvements: reduced morning stiffness, easier standing from sitting, decreased pain frequency and intensity, improved sleep quality, enhanced movement confidence, maintained independence in daily activities. These functional markers indicate meaningful improvements supporting quality of life and sustained independence. Conclusion. These 4 neuromuscular reset movements provide evidence-based benefits for adults over 50, including restored lumbosacral joint mobility, reintroduced rotational capacity, reactivated deep spinal stabilizers, enhanced pelvic control, and reduced chronic stiffness. These practices require no equipment, minimal space, and can be performed safely at home with proper attention to body signals. Start with one movement using proper form and awareness. Practice consistently daily. Progress gradually to all 4 movements. Use gentle approach always. Combined with proper posture habits, regular position changes, and comprehensive wellness approach, these movements support continued spinal mobility, pain reduction, and functional independence after age 50. Thank you for watching. For specific concerns about appropriate movements for your situation, consult healthcare provider or physical therapist for personalized assessment and guidance. Subscribe for evidence-based information on neuromuscular retraining and spinal health for older adults, practical guidance prioritizing body awareness while helping you maintain mobility and independence through gentle, effective practices.